The reason that I want to focus on it is not just mind over matter is there's kind of a new age cruelty that I hear sometimes that implies that if only you had your mental act together, you wouldn't be having this physical problem. You know, everybody's nodding. And doesn't it feel like a jab? And don't you just feel like saying something? I'm on camera. I can't tell you what I felt like saying when I... Yeah.
I can.
So that's not what that is. That's not what mind-body medicine is about. It's not that simple. It also is not a statement that you've done something wrong in your life. So if you could just figure out some major element, that everything would be peachy keen. And it also, very specifically, does not mean that everything is in your head. You know, you've all been there too. You go to the doctor and there's not necessarily a clean, clear diagnosis or a clean, clear pathological understanding about the symptoms you're having, and so the automatic assumption is it's in your head. And you know good and well you're feeling it. And it's not just in your head where you've got the sensation. So I want very much to emphasize that this is not what mind-body medicine is about. So what is it? Well, I've alluded to a couple of things. And any of us who've had a life-altering disease, or particularly life-threatening disease, knows this. Mind-body medicine is nested, housed on the premise and with the understanding that we are more than our body. We are more than our body. So when we have a life-altering disease or experience or crisis or any experience in life, it is more than our body that is having that experience. It's more complicated than just physical ailment with physical explanation. And as soon as you start to buy into that, which is almost a self-evident statement, isn't it? It's sort of, you know, duh, well, okay. But you see, this is profound. And any of us who have had a life-altering disease knows this. You have the experience of kind of walking along, tootling along, doing your life, right? And isn't it funny? We identify ourselves in very many different ways. We identify ourselves by our name, by our appearance. We look in the mirror and, okay, we might carry on about the new gray hair and the new wrinkle, but you know, it's sort of gradual, these changes we go through. And we have time to get used to them. We look in the mirror and it's reassuring. It's the same person that was there yesterday. You know, we identify ourselves by the work we do, by our careers, by our relationships. So I'm not just Jane. I'm Jane, a nurse who works in the hospital, who's a wife and a mother of Joe. You know, and this is how we identify ourselves. And the thing that a life-altering disease does is it takes you out of that track and takes away a whole bunch of your identifiers. How many of you had that experience? Yes. And so you're tootling along doing life, and all of a sudden, the track, you know, we have this trajectory that we call the future. We expect the future to be a certain way based upon ourselves right now, based upon these definitions of ourselves. So it's as if a life-altering disease, particularly life-threatening disease, picks us up and puts us in a different track. What do we do with that?